Good morning from Austin, Texas at the Combined Ophthalmic Symposium. We're pleased to have this morning Dr. Doug Koch. Thank you, Doug, for being with us today.
Thanks, Jonathan. Pleasure to be with you.
Doug, I think one of the interesting topics that we can perhaps discuss this morning is about new innovations in refractive surgery. And specifically, I think you have some experience with some of the new technologies that are available. Can you explain for us what's new and how they work?
Well, one of the exciting things in excimer laser ablative surgery right now is two technologies that are potential for treating irregular corneas in addition to perhaps enhancing results with normal eyes. Mm-hmm. And those two are Contura and the iDesign 2 technology, one from Alcon, one from Johnson & Johnson. The Contura technology is really very heavily topography based, but you of course have to incorporate refraction, and because it's topography based, has a lot of potential to treat irregular corneas and restore a more normal shape. The trick there, I think, is getting the refraction right, because if you're treating topography and then you have to anticipate what that effect on refraction will be. The iDesign technology is a very sophisticated wavefront technology that also incorporates topography. It uses an LED system for topography, and at the same time the patient's wavefront is taken, a topography is taken centered in the same way, including in the center of the cornea. And the data from the topography are used to interpret the wavefront, and then they're also used to calculate the treatment. Specifically, they're used to determine the cosine effect so that the treatment that is applied should be more precise. And obviously the holy grail for both of these is we do better for normal eyes, and we do also much better for the irregular cornea.
That's kind of what I wanted to unpack a little bit here, Doug, is what type of irregular cornea are we talking about here? And as well, can we quantify, or in general, how irregular are we talking? What is the source of the irregularity that we're speaking about? And how irregular can we really go in considering these treatments?
We don't know. We can perhaps restore better centration and decentered ablations. We could treat perhaps post-RK eyes. We might be able to treat some other irregular topographies, post-PKP perhaps. There may be a whole range of things. Obviously, there's certain topographies like keratoconus where you have to be very cautious, but perhaps, again, combined with cross-linking, you might be able to do some wonderful things. So I think it's very exciting to see how these things might kind of work their way into these more challenging corneas.
Understood. And if we can go back and talk about the normal eyes for a moment, just to play devil's advocate, a lot of people might say, look, Doug, the treatments that we have available for quote-unquote normal eyes now in terms of wavefront guided treatments available in the United States are already quite good. So how much better do we really need to be? It sounds like this is combining both wavefront and topography-guided technology and perhaps getting the best of both worlds. Am I understanding that right?
Yeah, the Contour is really much more topography-based. The iDesign is more wavefront-based, but a more intelligent wavefront. And if you have a more intelligent wavefront, maybe you're going to do a better job at reducing higher-order aberrations. Remember that even with the best ablations that we do, we are still inducing aberrations. We may be taking somebody from -6 to plano, and their overall quality of vision improves because of the reduction of their myopia, but we're probably increasing their spherical aberration, and we may increase their coma a little bit. And if we could suppress that change, then I think we may be looking at that holy grail. Years ago, we had 2010 by 2010. Well, 2010's long gone, sure. But maybe 2010 by 2020 in terms of better quality of vision.
Well, Doug, this is an exciting time to be a refractive surgeon, and I appreciate your explaining for us these novel technologies for cornea refractive surgery. Thank you so much for being with us.
Thanks, Jonathan.